There we go. All right. So, genitourinary conditions. So, the first thing we'll look at is the general layout of the kidney. We've got our two kidneys, right and left, followed by the ureters, which are the large tubes that lead down to the urinary bladder, which is there. And then the bladder has a tube leading out of it called the urethra, which is where urine exits the body. Inside the kidney, there's a lot of really fun stuff going on. So we're just gonna kind of remove the outer layer here. This is what the inside of a kidney looks like. So each of these little lobes here are called renal pyramids. And they function to filter the blood. So the blood is pulled into very, very tiny capillaries. Lots of really fun stuff is going on in the kidneys. The end result is all of the nasty stuff is filtered out. The rest of the blood is shunted back into circulation. So the kidneys are constantly filtering the blood. They will filter somewhere around 11 pints of blood per day. So just lots of blood filtered all the time. Once the waste products have been removed, they're going to be shunted down other tubes in order to be accumulated for removal. So if we just remove this portion here, we can remove the fatty layer. You can start to see the tubes. I'm going to open them up a little bit more. So inside these pyramids, the fluid is filtered down into this area, and it is these tubes here where we are most likely to form the first pathology we are going to talk about tonight, which is kidney stones. So kidney stones are formed here in the calyces, and deposits of this material are called calculus. The calculus is formed mainly by calcium oxalate, or sometimes calcium phosphate. That's the main mineral that's found in your bones. So as all of the blood is filtered, all of the waste products that are going to go on to become the urine can start to crystallize, particularly if there's a high mineral content or if there is a low fluid content, meaning you're dehydrated. So small kidney stones, the really tiny ones, can sometimes pass and you'll never realize them, but larger ones in particular can start to become a problem as they obstruct the flow of urine. And if you've never seen a kidney stone up close or what they look like, it's worth noting. Let me pull up a really good, yeah, there's a really good one. So these incredibly sharp, jagged crystals of, minerals start to cut and tear their way through the ureter, which again, guys, the ureter doesn't really have a whole lot of muscle in it. So it's a really thin, kind of flimsy, little flappy little tube. It's really not super substantial. It's literally just meant to transport fluids. So it tends to be really soft and squishy and delicate when a hardcore crystal like this goes digging and tearing its way through. So kidney stones are, number one, super painful. I kind of grin when I say this, little side joke, but I often say kidney stones are more painful than childbirth, only because no one ever wants to have another kidney stone, and people go on to have like 3 or 4 or 5 kids. So, I mean, how bad can it be? I'm kidding. That was a joke. This is my joking face. Okay, so symptoms of kidney stones. Number one, holy cow, they get incredibly painful, like second to none, most excruciating pain some people have ever experienced. It generally starts off rather mild. It starts feeling kind of like low back pain. And it's really easy to think that maybe you just like sat too long at work or something like that. But eventually the pain starts to morph from kind of a dull ache into more of like a really sharp stabbing, kind of tearing pain. It feels like something is just cutting its way as it slowly progresses down to the bladder. You'll also get like waves of nausea because of the pain. Some people have like cold sweats from the pain. If they become too large or if they become obstructed, then you may have to go have like a procedure done. If they're too big, usually what they'll do is try to shoot them with an ultrasound machine. It's not the same kind of machine they use to image babies with. But the ultrasound machine uses ultrasonic waves to blast the stone, and it breaks it into several small pieces. And then the idea is those smaller pieces will move a lot more easily. Another procedure that they can do is they take this special instrument and they go up through the urethra, through the bladder, and then they snake their way up the ureter, and then they grab a hold of the stone and they pull it out. You are knocked out for that though, like you are under anesthesia. Glad to be here. But usually the way that they deal with them is you just got to let them pass. You just got to endure. It's like some weird Klingon ritual, man. The whole point is to just endure the pain. If you're really crazy like me, you sit there with a really fine mesh strainer and you pee through the strainer so that when it finally comes out, you can catch it and you stick it on your fireplace mantle and like, ha, look at this thing that I conquered. So signs and symptoms, like we said, renal colic. Renal colic is the phrase where it's painful. It comes in waves. A lot of flank pain, flank like meaning the side of the body, fatigue, nausea, cold sweats, and the pain as it goes down towards the bladder can start to refer into the groin. So guys, you may feel like testicular pain. Ladies, you may feel labial pain. It's a very, very painful experience, and I don't wish it on anybody. The major cause is dehydration. So they often tell you to drink cranberry juice is the usual thing, cranberry juice. Just drink water. Just drink lots and lots of water. You'll be fine. Good stuff? Good stuff. All right. Renal failure is the next one. So renal failure, the name is pretty self-explanatory. The kidneys are failing. They stop functioning adequately enough to remove toxic waste products. And so these products start to build up in the blood, making the blood really toxic. So symptoms of renal failure, well, since the kidneys are outputting urine, one of the first signs that there's something wrong with your kidneys is that they stop outputting urine. So you experience a decrease in urination. You may notice that you're only going maybe once a day. The key issue here, though, is that you don't have the urge to go. If you feel like you got to go and you can't go, that's a separate problem. The issue with renal failure is you just kind of reduce your urination maybe once a day or so. This also leads to fluid retention because you're not excreting those extra fluids. So the body will start to swell up with edema. Fatigue, headaches, heart arrhythmia because your fluid balance has gone off, so your electrolyte levels are off and your heart is low in potassium.
Hey Dave.
Yeah.
Did you mention massage considerations for kidney stones?
Oh, thank you. No, do not massage people with kidney stones. They are contraindicated acutely. After they have passed the stone, yes, they would. I'm sure they would love a massage. But when they're actively passing a kidney stone, it's just, you don't want to put any real pressure. Laying face down may be uncomfortable for them. Laying flat on their back may be uncomfortable for them.
They probably wouldn't want a massage, right?
Yeah, and that's the other thing is, like, if you've never experienced one, it's really hard to describe with words the exquisite torture of a kidney stone. So yeah, they most likely are not going to be looking for a massage. They are doubled up on the bathroom floor in pain. Yep. Thank you. Contraindicated acutely, but after it resolves, you're good to go. You're good to go. So renal failure. kidneys are failing for a variety of reasons. Lots of different things can cause this. We start to see a decrease in urination. Increase in edema because now there's a fluid imbalance. And because of the fluid imbalance, there is electrolyte imbalance. So the heart is lacking potassium. So we start to see a heart arrhythmia. As this condition continues, as it gets more progressive, we'll start to see anemia as the blood is no longer being filtered. So the blood is so toxic that the red blood cells will start to die somewhat prematurely. This could also lead to seizures as the brain becomes toxic and lacks nutrients and waste removal, which will also lead to changes in mental status, confusion, things like that. So the general treatment for renal failure, if you can't fix the kidney, or while you're on the list waiting for them to replace the kidney, we have to manually remove the blood and clean it with a machine and then pump the blood back into you. This is kidney dialysis. Kidney dialysis is done, oh, it sucks. 3 times a week, you got to go to the dialysis clinic. You're there for like 5 hours, 3 times a week, just sitting there hooked up to a machine. Has anyone ever donated plasma before? Donated blood plasma? I can't see it. Has anyone ever donated blood plasma? Yes, one of you. The machine is very similar to the plasma donation machine, whereas the plasma machine is obviously separating plasma, and they keep that and they give you back your red blood cells. With the dialysis machine, it's taking the blood, it's removing toxic products, taking the remainder of the blood, which is now clean and healthy, and then they return that whole blood to you. You got to sit there for like 15 hours a week, man, just sitting there with a needle in your arm. It's no fun. It is no fun. They will also, since their kidneys are failing, it will relieve the edema, but over the next few days, they'll bloat up again in anticipation of their next dialysis appointment. So their weight just really fluctuates, and they can gain a lot of fluid weight in between dialysis treatments.
So do you have to just continue dialysis till your kidney finally gives out?
Yes.
Oh, so it just prolongs your life a little bit longer then.
Yes. Trust me, dying of a failing kidney is much worse than undergoing dialysis. But
yeah,
dialysis is still, I mean, it's rough. It's rough. Yes, you will continue to be on dialysis until either the kidney gets healed, which doesn't often happen, or the kidney gets replaced, which usually you're on a years-long donor list. But kidneys, man, you got 2 and you can live with 1, but both of them are precious. You really got to take care of those things. So for renal failure, clients going through renal failure, they cannot have circulatory massage because obviously their whole circulatory system is compromised at this point. So spot work on like a certain area, things like that, but no general flowy, increasing circulation type stuff. They're going to be relegated to lymphatic drainage, energy work, maybe craniosacral, maybe, but most likely just very, very gentle techniques or very, very hands-off techniques like energy work.
Do they really, I mean, would they want to have massage? Like, would they feel like they're benefiting from it?
They may, particularly with energy work. And when anyone is really sick, they could always do with compassionate touch. So all of the other side benefits of massage, and particularly of energy work, you know, things like the relaxing, the calm, just helps promote the inner environment for healing. But you're more likely to see clients like this working in a hospital setting. It is far less likely you'll see clients like this if you're working in a spa or in a chiropractic clinic.
Yeah.
So we have 2 general types of renal failure. There's acute and there's chronic, and pretty self-explanatory. So acute renal failure is usually going to be caused by some kind of infection or some kind of infarction, like maybe there was a heart attack, and so now that's why the kidneys are having an issue. Dehydration will do it. Trauma to the body, particularly rapid blood loss. When you lose a lot of blood, shocker, the filters of the blood start to gum up and they don't work proper. We can heal all of those things, right? If they recover from the heart attack, right, from the infarction, then the kidneys will usually recover, but they're going to suffer in the meantime until the heart issue is fixed, or your dehydration condition is fixed, or until you've got enough blood back in your body. Now, the chronic renal failure is usually, well, chronic is ongoing. We could have issues where the kidney tissue has been slowly over time replaced with scar tissue. This is common with diabetic clients. This is common with people who suffer from hypertension. It's almost like cirrhosis of the liver, where the liver becomes covered with scar tissue from alcoholism, except this time it's with the kidneys, and it has to deal with things like blood pressure. And we know diabetes affects blood pressure. It's comorbid with obesity, which is hard on blood pressure, hypertension. Renal insufficiency is when the protein, they're not filtering out enough, they're insufficiently filtering, so leftover proteins get slid into the urine, and that causes you to feel really crappy. This is common during pregnancy. This is a condition called toxemia. It's detected by levels of protein in the urine. Toxemia also goes by the name of, wait for it, preeclampsia. Preeclampsia. Preeclampsia and toxemia
So
both fall into this.
it's the filtering is insufficient, which causes protein in the urine.
Correct.
Yeah.
Correct. And
with my condition, this was a danger if it got too severe, which I'm very glad it didn't. But
which condition? I'm sorry.
HSP nephritis. So my kidney filters weren't filtering properly, so there was too much protein in my urine, and it was this whole thing where there was a possibility that if it got too severe, it could go into renal failure, but I didn't.
Yeah.
So
good.
All okay, but that just reminded me. I was just like, oh, I recognize that.
Absolutely. So tell me, how did it feel when you were going through this physically? Like when you had protein in the urine, what were your symptoms?
Oh, I'm not sure if I remember my physical symptoms so much. This happened, well, started like my freshman year of high school, but was only like officially diagnosed in the summer between my freshman and sophomore year.
Okay.
And so it was like every week I had to go up to Dornbecker to get these IVs of prednisone. And I was also taking prednisone orally to like really knock it out. And so, I remember feeling sore and my face swelled up because it was a steroid medication, so I was blood. I more remember my mental state. Like I got really isolated during that time because it was summer and my parents were working. So I was alone most of the time. And the hospital trips ended up being the highlight of my week. And that was just sad.
Poor thing.
Yeah, it was like the worst summer ever.
Oh.
I'm including 2020 here. And 2021.
Whoa. Well, I'm glad you got better.
Well, yeah, it was supposed to knock out completely. Not completely, but I still have a bunch of scar tissue, but not enough to be concerned at this point.
Good.
Yeah.
Good. So
Yeah.
scar tissue. All right. Last we have end stage kidney failure. So end stage kidney failure, as you may infer from the name, happens when you get to the end. We're talking about 90% of the kidney function is lost. This is when dialysis becomes necessary. And chronic renal failure, by the way, this is often one of the causes for death when they say people like died of old age. This is usually the actual cause of death, is the chronic kidney failure. All right. Next, we are going to talk about UTIs. Yay! Said no one ever. Said no one ever. UTIs are the worst. So UTIs are urinary tract infections. So these are usually bacterial infections that infect the bladder or urethra or ureters in some cases. This can lead to kidney infection if the infection ascends all the way up to the kidney. So we usually try to catch these pretty early. Urinary tract infections are more common in women than men. Let me think. Antibiotics is usually the trick. They just give you some antibiotics and you're usually fine. Pain, burning, particularly during urination, is usually the first sign. You may have a more frequent urge to urinate. There may be blood in the urine or sediment or stuff. They usually don't run a fever with the bladder infection. Fever will be present once it gets up to the kidneys. So once it gets really serious, you'll start running a fever. But UTIs usually are not super severe on their own. So if they have a kidney infection, they're contraindicated. All infections are contraindicated. But if they get if it gets all the way up to the kidney and they have a kidney infection, you cannot touch them at all. They are fully contraindicated. A bladder infection is pretty local, so they could still get a general massage. You would just avoid the bladder, but we don't usually massage in that area to begin with. But local contraindication when it's in the bladder, but it's a systemic contraindication if it gets up into the kidney. For women, usually I said earlier it was bacterial. Usually it's E. coli or usually it's E. coli from the digestive tract that gets brought into the urinary system. In men, it's usually due to prostate enlargement. And what happens is because the prostate's enlarged and they're having trouble urinating, they can't completely empty the bladder. So a little bit of urine remains inside, which means it's a dark, closed, wet environment, which is really good for bacterial growth. So they've got a really good medium for the infection to grow. Things that can make you more susceptible: the use of spermicides, the use of diaphragms or what's the word I'm looking for? Diva cups. You guys know what I'm talking about? Diva cups.
Yeah.
Yep. It's just again a foreign object in the region. Pregnancy brings a high risk of kidney infection. Diabetes leads to kidney and bladder infections because the urine contains so much sugar. And then if there's anything else going on with the bladder, like if you've had a catheter or anything like that, you may be more prone to urinary tract infections. Good stuff. Questions before I move on? Cool.
So it has nothing to do with being dehydrated, right?
Not a UTI, no.
Can you have one
Not a-
without knowing it?
A UTI?
Yeah.
A mild one, yeah, I imagine you could. Usually the main symptom is like a burning pain when you urinate, and then like blood in the urine. But if it was a mild infection, you may have one without realizing it. But usually you realize when you've got a UTI.
A lot of time in like assisted living homes and memory care facilities, older women end up with UTIs and don't really know that they have them. And I don't know if it's like because it's a mild infection, but it causes some of them to go crazy.
Well, memory care centers, you're saying, so they're, I'm
Dementia.
guessing that you're saying they're impaired so that they can't say that they have a UTI, like they can't communicate that.
Yeah, I just know it happens in memory care, and I mean even assisted living. Yeah, it happens pretty frequently.
With memory care, it would be dementia and Alzheimer's, so they wouldn't be able to associate that most likely
Mm-hmm.
because of their memory. My
I
mother,
mean, it does seem reasonable to me that one could have a UTI and not be aware of it. So, yeah, I don't have much to add to that, Amelia, but yes, I agree with you, certainly. Okay, the next one we're going to talk about is pelvic inflammatory disease. Pelvic inflammatory disease, or PID. This is an infection of the uterus, infection of the uterine tubes, fallopian tubes, or abscess on the ovaries. An abscess is just an infection. So signs and symptoms: massive infection, so fever, right? Pelvic pain, nausea, vomiting. They'll see chronic kind of low grade pain, like the pain just lasts a really, really long time. Pain with urination, pain with intercourse. So we don't massage this area, so we could say that it's contraindicated acutely during a pelvic inflammatory flare-up. However, even without a pelvic inflammatory flare-up, we don't massage this region. So, but we would avoid, massaging over the abdomen or, around the area, just because there's an infection going on. You don't ever want to massage over an infection. Causes of pelvic inflammatory disease: infectious organisms. So when we talk about infections here, we're usually talking about things like chlamydia and other STDs. And infections in this area can lead to other kinds of conditions, like peritonitis, inflammation of the lining that surrounds the abdominal organs. This can also lead to infertility, because you're talking about chronic inflammation of the ovaries. We could be causing ectopic pregnancies. Since the inflammation is spread throughout the uterus, the fallopian tubes could swell shut. So the fertilized egg cannot travel through the fallopian tube, so it just embeds in the fallopian wall. Ectopic pregnancies have got to be terminated. It will kill the mother. And then, of course, chronic pain. Just the good old-fashioned chronic pain that never goes away. So UTIs are urinary infections. PID, inflammatory disease. right, next one we're going to look at is endometriosis. So endometriosis is understood as the body's reaction to something that generally is rather normal. So what happens is uterine lining cells are found outside of the uterus, and this is common to find in many women, but some women's bodies react particularly strongly to this. So this leads to a lot of inflammation, a lot of pain going on down in the pelvic region. And again, most women have endometrial cells in the pelvic cavity, particularly when they're on their period. But not all women develop endometriosis in this way. So the cells are still responding to estrogen and progesterone. So these cells are swelling and shedding, just like, right, we talked about like the, oh, that was my anatomy class last night, not you guys. I just taught female reproductive system last night. And we're talking about how when a woman's on her period, the inner lining of the uterus is like getting ready for a party. We're putting up decorations. We're throwing out tablecloths and centerpieces. We're getting ready to throw a party. And then when no one comes, we just rip all the decorations down and throw them away. So with endometriosis, these cells are found outside the uterus and they're preparing for a party. So they're becoming engorged with blood, and they then start to shed, which causes local decay, a little bit of decay in the areas, and inflammation and pain. This can cause the inflammation can lead to the development of scar tissue, which forms adhesions in the region. This can also cause ectopic pregnancy, again, through adhesions, and by causing inflammation, we can cause the fertilized egg to get lodged in the tube while it's on its way to the uterus. And this can also cause anemia. It can lead to anemia. Usually one of the treatments for endometriosis is to put a woman on birth control pills. It's not for the birth control effect, but for the hormone regulating and cycle stabilizing effect. Usually the problems are with the treatment. So the treatment for this condition is birth control. So you're fine until you want to have kids, and then you have to come off the birth control in order to get pregnant. But when you come off the birth control, the endometriosis flares up again. And if the condition is left to continue flaring up on its own, it can lead to infertility. So that's the catch. That's the catch 22.
Is massage good for endometriosis?
It is indicated for endometriosis, but we do want to avoid the abdominal work. The most that I would do is apply heat. A nice hot pack feels particularly nice on the abdomen, but I'm not doing any work over the abdomen for endometriosis, no. All right, guys, the next one we're going to talk about is pregnancy. And I understand if some of you guys raise your eyebrows at me, because I feel like we can have the debate as to whether pregnancy counts as a medical condition or not. I have personal feelings on the matter. Personally, I do not think pregnancy is a medical condition. Pregnancy is a human condition. So no more than like having to poop is a medical condition. It's just something the body does. But I will digress. Generally, what we're looking at here is pregnancy, as in the kinds of massage contraindications related to pregnancy. So what is the etiology of pregnancy? Well, it's carrying a fetus. Signs and symptoms, amenorrhea. Amenorrhea is a lack of a period. You stop having your period. They say that so authoritatively, like, oh, that as soon as you're pregnant, you stop having a period and you don't have one again until after you've had the kid. That is not, in fact, always true. Many women continue to have periods several months into their pregnancy. So just missing a period is not always a good enough thing. Like some women are still bleeding a few days, months into the pregnancy, and everything was fine. So amenorrhea, we have breast changes, ligament laxity. So the ligaments start to loosen up. You're starting to produce a hormone called relaxin, which is the best named hormone ever. Relaxin. Relaxin relaxes soft tissues, so it loosens up ligaments so that your joints come a little bit looser, because the pubic symphysis in the front of your hip joint comes unhinged so that you can pass a baby through the hips. It's fascinating stuff. Pregnancy also leads to a number of postural changes. As the baby grows, it throws off your center of gravity. So the whole alignment of the skeleton gets thrown out of whack. Also, all of your organs have to kind of shuffle around in position to make room for this growing baby. So breathing starts to get a little more interesting when your lungs can't expand fully. All of your organs have been pushed out of the way. Let me think. So the center of gravity, there's a lot of pressure on the pelvic floor. This can cause venous blood to backflow and push against those one-way valves, which damages the valves and leads to varicose veins. The weight in front causes the hips to roll forward, which causes an exaggerated lordotic curve. Where's my little pregnant woman? I am not an art major, first and foremost. I just want to make that very clear. That's front. So as the little baby is growing, and there's the little baby, he's upside down. So as the back starts to roll forward, you start to see an exaggerated lordotic curvature. This causes the upper back to, now you've got to lean way back. So this leads to kind of a hunchback situation. All the pressure on the pelvic floor starts pushing venous blood back down. This leads to varicose veins. You are putting on a lot of extra weight, a lot of where the body will start to store a lot of fat so that we have nutrition and energy nearby for all the milk that we're going to have to be producing here coming up. So now that we've explained that, I'm just going to erase this because I don't really like looking at that. It's a little nightmare inducing to me. Sorry. So for pregnant clients, massage considerations, number one, we generally do not lay pregnant women face down. So side lying is preferred, or kind of a lateral recumbent. We also do like a reclining position where they're laid back, but they've got a bunch of pillows shoved underneath them. So they're just kind of like laying in this really pillowy chair on your massage table. Some women, when they're pregnant, can lay flat on their back. However, that is really uncomfortable for some people. So generally we just go with the side lying condition. Watch for dizziness getting on and off the table. Their positioning is really important. So you want to make sure that they're, particularly when they get obviously pregnant. If you've never seen a prenatal massage done, they're usually laying on their side. They've got a pillow under their head. They've got a pillow that they're holding onto. There's a pillow under their belly, and there's a pillow between their legs. So they're laying on their side, just like pillowed out. And then you massage from shoulder to ankle, and you flip them over, you shoulder to ankle, the other side. They do make pregnancy support pillows, which are these really fancy pillows for massage tables where you can lay a pregnant client like face down. There's like a big pillow with a big cutout for her belly. So she just lays down into it. If prenatal massage is your thing, they're worth it, but those are like $700 sets of pillows. So if you're not like into prenatal massage, it's probably not worth it for you to just have them laying around. Those are really, really expensive. You see, they're called body cushions. Yeah, something like this. So there's a pregnancy cushion. You can stick a pregnant woman face down on that thing right on your massage table. She puts her face in the face cradle. You notice that little tunnel thing at the bottom? Whoa. That's, she can stick her hands into it. But that is $350. So again, if you're not like invested in being a prenatal massage therapist, there's a bit of a cost.
Looks so comfortable.
Oh, it is more comfortable than it looks. It is way more comfortable than it looks. I got a massage on one that was more like this. So it wasn't like for pregnancy, but although you could totally use it for pregnancy, it was dope. It was so dope. It was like, you never realize how flat the massage table is until you lay on something like this, and then you never want to go back to laying on a flat massage table. It's the table that just conforms to you. Well worth it. Well worth it. Okay, so massage considerations for pregnancy. Number one, joint laxity. They've got a lot of looseness in their joints. So this can cause soreness and muscle spasms. But generally when we're taking pregnant limbs through a range of motion, we're not really pushing them. We're not really stretching them. You just want to gently carry them through a comfortable range of motion. Fatigue. Surprise, surprise, growing a whole baby is a bit of a workload. Yeah, it takes a lot of calories to bake a whole skeleton from scratch. So fatigue, hormone levels may be off. So maybe a little touchy, maybe a little mood swings. Give them a wide berth. Don't take any of it personally. They also may have shifting proprioception. So since the baby is growing and what we said, it's throwing off their center of gravity, this can throw off their whole sense of balance. So they may get a little dizzy from time to time. Also, as the belly gets larger and they can't look down and see their feet, that may also be a little disorienting from time to time. Just be available to help them on and off the table if necessary. We avoid particular areas of pregnant women, number one being the abdomen. Women are trying to relax when they come to get a massage, and babies in the womb are definitely aware of things that are happening outside. So if you put your hands on the belly and start like moving your hands around in a circle, it will wake up the baby and he will start getting energetic and start moving around and kicking kidneys and stuff. And now the lady can't enjoy her massage, because her kidney's being used as a punching bag. So avoid the abdomen. We also avoid the ankles as well as the web of the hand. These are due to reflexology points that are associated with the uterus and reproductive organs. So massaging clients in the first trimester, pretty much the major symptom is nausea. So first trimester, not usually that big of a deal. You want to be sensitive to positioning. However, many therapists will flat out not massage a woman in the first trimester. Again, the reason is more one out of caution The first trimester is the riskiest in terms of miscarriage. So if you're going to miscarry a baby, it is far more likely to happen in the first trimester. Therefore, just from a liability issue, many therapists just will not massage a woman in the first trimester. It's a judgment call. It's a judgment call. So if they get nausea, just be aware of your positioning. You may want to, put them on their side or recline them slightly, but just be aware they may be a little nauseous. They may not be able to lay on flat on their stomach for as long as they generally would, but just be aware. Moving into the second trimester, the baby is starting to get a little bit bigger. It's really starting to become a drain on her resources, as well as getting large enough that it's starting to throw off her center of balance. So lots of pillows. This is where you can no longer put her face down. So side lying. And cannot lay her flat on her stomach or flat on her back. So side lying is usually going to be best. And third trimester is pretty much going to be the same. As you continue seeing this client, you just want to keep checking in with her that everything else with the pregnancy is going normally. I don't need details. I don't need facts and figures and what tests you had and all that jazz. All I need to know is that the pregnancy is normal and healthy. Everything's going fine. If something is going on that is not normal and healthy with the pregnancy, I would like a doctor's note, please, before I proceed. A doctor's note, the physician will tell you what you can and cannot do. So, and at that point, it's on his liability insurance, not mine. So, but if anything is going on with the pregnancy, we need to know about it. Generally, just to make sure that we're not doing anything that may be risky for the pregnancy. Any questions? Any questions over anything we've gone over?
Dave, can you just clarify a little bit, like the first trimester?
Absolutely.
And I mean, I understand, right? Like miscarriage is a possibility at that point in time, but like, what would you do? And can you lay them flat on their stomach or no?
It is not recommended to lay a pregnant woman flat on her stomach, even in the first trimester.
Okay.
The second, that was the second part of your question. I think the first part of your question was to go a little more into it. So the vast majority of miscarriages are caused by genetic errors or errors in the reproduction of the initial cells. So most of the issues that go on with miscarriages have to do with genetics. It's the way that particular egg and sperm came together, all the copies didn't come together properly. So whatever this develops into, it's not going to develop properly. So that kind of thing, the body will sometimes just shut down and we try again. It generally doesn't have anything to do with massage itself. Like there's not much that you are going to do as a massage therapist that's going to cause a miscarriage. The most of the issue comes along with what happens when the two just happen beside each other. Like she gets on your table and gets a massage and you lay her face down, and then the next day she has a miscarriage, or 2 days later, or a week later. And is it likely? No, it's not likely. And I wouldn't even say it's common. But the first trimester of pregnancy is the riskiest trimester of pregnancy. And I don't want to have anything on my conscience that I may have done something that cost someone a kid. Like, no, not me. So personally, I don't massage women in the first trimester. Second trimester, I'm good. When we know that the pregnancy is healthy, right? And by the second trimester, the fetus has most of its organs. Most of those organs are fully developed by the second trimester. So I'm on board by that point. Now, That's my personal thing. So take that with a grain of salt, because there are many massage therapists who specialize in prenatal massage. I don't specialize. I've got a certification, but that was never a huge fraction of my practice. So I'm sure there are people who are far more experienced than I am who are more comfortable massaging in the first trimester. I just am not.
Even if it wasn't your fault, it would still feel really bad, you know?
Massage tends to call a lot of really empathic people and really sensitive people. And I'll be the first one to tell you, like, I don't like kids. I don't want kids. It's just not my life. But like, I don't, yeah, I don't think I could handle
Yeah.
something like that on my conscience. I couldn't. So, good question. Good question. All right. How about a break? Cool. We'll take 10 and I'll see you right back here.
Okay.
Okay, everybody. So, does everyone know how to play Cahoots? Yes? No.
No.
Awesome. Awesome. So then we start here. So I created this one to show you how to play the game. This one does not matter. It is 5 questions. They are very easy. It is just meant to show you how to play the game and you get a feel for it. A few things you should know. Number 1, you'll need your phone. So if you don't have your phone handy, you need to grab it. Number 2, you get more points the faster you answer. So you want to be like the first one. Remember, this game doesn't matter. This is just a stupid little 5-question one just to get us ready to roll.
You know, I won't be fast.
It's okay. It's okay. The point is that we know the answer. That's the point. So on your phone, you will need to open up your browser, Chrome, Safari, something like that. Go to kahoot.it. I can't make the thing bigger. Kahoot.it. You should be at a page that looks like this. So,
What's the pin?
it's coming up. Give me 1 second.
Oh, okay.
Gotta make sure my settings are right. The pin is coming up. There it is.
Did you say what the pin was?
1080017.
I don't think I'm in your guys' game.
Mm. We need to study our anatomical planes, huh? Good job, Andy. All right. So that was a little intro, nice little taste of how the game works.
Can you add me? Or is it too late?
It's too late for that one, but we're gonna play the real one. That was just to get us situated.
Okay,
So go to kahoot.it.
I got it. I'm in. I was playing along. I got all my answers right too.
Nice. Good job. All right, game pin's coming up. And there's 26 questions on this one. 5362573. Ooh, look at that. Answer first. Yeah, she's fast. Good job, Kay.
Yeah.
You typed K in the thing.
Accidentally.
We need to review our hyper and hypothyroidisms.
Yeah. Oh, shoot. Trying to go too fast, I think.
That one, that gets me every time. I go way too fast.
I got some
That was a
stuff.
tricky one. That was a tricky one, but I pulled it from the book. All these come from the book, so.
I'm off the board.
There was no debate in that one.
Nope.
That was fast. You guys got that one fast. That's why you got to get a colonoscopy after 50. Because once you hit 50, your rates go up.
Yeah. Oh my gosh.
Bile is produced by the liver to break down fats. That is what it does. That's why people without a gallbladder got to have a low fat diet. Calcitonin calcifies the bones. Calcitonin calcifies. Yeah, the cold doesn't hit you as hard as the body's response to the cold. That was a tricky one, I'll admit. That's a tricky one. The little tiny hairs that keep like this current, so that sheet of mucus is constantly being pulled up and out. The pituitary does not secrete all the hormones in the body. Hypothalamus, we've got testes and ovaries and thyroids and thymuses and adrenal glands, not pancreas. Good job, Mandy. Bree, Zebedee. No one got this one right. This was a tricky one, I will admit. Nope, we're not doing this again. Nope. Nope. That's it. That's all. That's all I got. So if you are feeling in a study mood, you can go to kahoot.com, search for my username, DH_OSM. You can get all the Kahoots that I've like ever made, and there's a lot of them. So keep checking back there if you have other classes, because I've got Kahoots that I've made for muscles and organ systems and bones and bony landmarks and consultation, lots of stuff. I've made them for lots of stuff. So go check them out. Pathology 2 test that you just took is clearly labeled, so you guys can play the game again and study. Otherwise, your final exam opens tonight. You have a whole week to take the exam. So the exam will close at the close of business on Tuesday, 11:59 p.m. next Tuesday. The final exam is 49 questions. Most of them are true false. Some of them are, no, some of them are true false. Most of them are multiple choice, is what I mean to say. There are a few matching questions, a few short answer type questions. If you've been paying attention and you've been studying, I do not think that it will be a very difficult exam. But if you've put off all of pathology until the last week, you're gonna hate your life. So if you've been studying, you've been paying attention, you'll be just fine.
How do we find
Any
your
questions?
transcripts?
Oh, go to kahoot.com.
Yeah. I'm there.
And search for my username.
I don't even see a search. What do you mean? Search for your,
Sorry, here, discover. Whoops. Continue for free. No, I'm not paying for Kahoot, never have. Discover. And then in the search bar, right here.
I didn't see discover. I'll figure it out.
It's at the top in the tab. It says Kahoot, home, discover, library, reports, groups.
Oh, I saw library.
You may have to create it. You may have to create
Online.
an account. You may have to create
Okay.
an account.
Okay.
But
I'll just get the app. It's at the bottom. I saw a library, so.
yeah, if you just search for my username, DH_OSM, it will take you here. And then any of the quizzes you should be able to click on and not only play, but then you see my little username tag here at the bottom. You should be able to click on that
Okay.
and it will take you to my account. And then you can see like, oh gosh, Dave, it looks like you're a massage teacher. Look at all those, look at all those Kahoots you've made.
That's
But
a lot.
yeah, I am a teacher and I have no life. But I even made the intro one. If you've never played a Kahoot before, like 5 simple questions just to give you an idea. But these are good resources, lots and lots of little quizzes and stuff. So have at them. Path 2 is the newest one, so it's right up at the top. So you shouldn't have a hard time finding it. Other than that,
You didn't find
if you
it?
guys have any questions, you guys can reach out to me on Moodle or via email. Study hard before you take the final, though. Set aside, some time. And that's it. That's all I have for you tonight.
Thanks, Dave. So we're not meeting next week, right?
No meeting next week. So if you need to, use your blocked off class time for next week to sit down and take the final. But we are not meeting next week. No Zoom. This is our last one for Path 2.
Thank you.
You're welcome.
Bye, everybody.
Thanks. Have a good one.
Thank you.
Bye.
You too.
Bye, everybody.
Bye.